I've got a 5-year-old kitty who weighs about 12 kilos, who's having a tendon transfer. So I'm going to do a supraclavicular block on him for his tendon transfer in his right arm. What I've got on the ultrasound screen, if somebody could just put the arrow there, is it's more interscalene, although you can see the pulsation of the artery, the subclavian artery. So there's the subclavian artery, and then above the subclavian you can see the nerve roots. Now some people talk about that as being a snowman. I'm from Africa and I've not seen snow in South Africa, so I don't know what a snowman looks like. But what you can see is some dark rings all in a row, and that's why I prefer this block, because you can block each trunk individually. So what I'm going to do now is take my Stimuplex needle. I'm not going to use nerve stimulation, and I'm simply going to approach those nerves. And what you need to do is line them up in a way that's convenient. And I'm going to go interscalene. Just need to get through there we go. Let me just get the image back. I'm just busy trying to line up my needle. You can see the needle approaching, and you're going to pop. Let me find my needle. The problem is when you're coming in a 45-degree angle, you don't see the needle as well, but I know that I've just popped through the plexus there. Let me find the needle properly. But visualization of the needle at this angle can be a little bit tricky. But what I do is I've got the needle in the lower trunks now. There it is. Okay, so that I'm at the lower trunk at the moment. Now, if you can inject a little bit of local anesthetic, can you inject a cc of local anesthetic? It's useful to have an extra pair of hands. Now, you can see the local going in. Okay, so start deep, because if you put the local in the superficial trunks, it tends to distort the picture. So there I am. The local is going in. The image quality is not as good because I've got a tegaderm on. So just put a CC in, and then I'm going to withdraw the needle. I'm withdrawing. You can see it on the right-hand side. You can move the arrow to where the needle is, a little bit higher. There it is there. So there's the needle being withdrawn. The local is going to go in again, a CC. 1 CC. Okay, you can see that I'm going to advance again, just to show you that you can see where the needle is. And I'm going to aspirate, because you want to make sure you're not in there's now the deep part of the local, and as we inject slowly, just one more, there we go. That's enough. Okay, and now a little bit more local anesthetic as I withdraw. Okay, you can stop there. So I've given him what to use is 0.3 ml per kg. So this kitty weighs 12, so we've given 4 cc's, which is more than enough for the block. If we've got something to clean, or just to wipe clean. So that's how, for an interscalene block, I usually massage it after I've put it in just to spread it evenly. I believe anyway, it spreads it evenly within the brachial plexus and seems to, with a little bit of faith, seems to improve the block. But I have no science for that whatsoever. It's just a habit that I've got into. So that's the interscalene or supraclavicular approach. What you need to be aware of when you're doing this with ultrasound is where the tip of your needle is. Although it is difficult when the angle is steeper, there are various ways that you can use the echogenic needle, which we don't have, which we talked about earlier today. There are various techniques to identify your needle. I was pretty convinced that I could see the tip, because as I moved it, I could see that the tip moving. It might not have been as easy to see for those of you that are not used to ultrasound. And I'm happy to answer any questions.
Dr. Adrian, there's a question on your median nerve block from a Dr. Dinesh. He wanted to know the current use that you were using for stimulating it transdermally.
What was I using?
Yeah, what current intensity were you using for the transdermal?
You need to be above about 3 milliamps, but it obviously depends on the resistance. What I did was put a little bit of saline to moisten the skin, which usually allows you to get down to about 3 milliamps. But again, it depends on the current strength, the resistance to the skin. Moist skin obviously is less resistant. But on that kitty I used 3 milliamps, but it's anywhere between 3 and 5 milliamps that you can use to map the nerve. It also depends on the depth of the nerve as to how much current you use.
Okay. Thank you.
Okay.
I think we'll go on to our next speaker now, who will be talking on brachial plexus, Dr. Venkateshwaran, please.